What is a heart attack? A heart attack is a common term used for acute heart failure. Like chronic heart failure, the severity can vary from an event that is virtually symptom-free to something that is life-threatening or fatal. Since the most common cause of acute heart failure is a myocardial infarction, usually abbreviated to MI, the two terms are often used synonymously. It occurs when part of the heart muscle is prevented from getting its blood supply, usually by a blood clot blocking off the artery. As a result of this, part of the heart muscle becomes permanently damaged. Typically, a heart attack is associated with severe chest pain lasting for more than 15 minutes. This can spread to the neck, jaw, arms, or through to the upper back. It is usually, but not always, accompanied by sweating, breathlessness, nausea and/or vomiting, burping, or a feeling of indigestion. When part of the heart muscle becomes deprived of its blood supply, the muscle can become irritable. This can lead to a disturbance in heart rhythm associated with palpitations, lightheadedness, and sometimes blackouts. Occasionally, heart attacks are silent, producing no symptoms, and are discovered only when other investigations are performed at routine medicals or when patients present with other symptoms. Angina is different to a heart attack. Angina is caused by insufficient blood and oxygen getting to the heart muscle, and is usually due to narrowings rather than complete blockage of the coronary arteries. The supply of oxygen is usually sufficient at rest, but inadequate to meet the needs during exertion. The pain associated with angina is often less severe than the pain from a heart attack and does not last as long. GTN tablets or spray will usually relieve the symptoms of angina, but will not relieve the pain associated with a heart attack. Angina occurs during exertion or stress, presents as chest tightness, which may spread to the arms, neck, jaw, or upper back. The duration of symptoms is usually less than 10 to 15 minutes. Symptoms relieved by rest or GTN. No permanent damage occurs. Heart attack. Unpredictable onset, often at rest. Similar discomfort to angina, but more severe and usually associated with nausea, vomiting, shortness of breath, and sweating profusely. Symptoms usually last more than 15 minutes. Symptoms are not relieved by rest or GTN. Results in some permanent damage to the heart muscle. The heart muscle that is injured by this blockage may become irritable, and this can cause irregularity in the heart rhythm that can prove fatal, even when it appears that very little heart muscle has been damaged. This is why it's very important that if you think you're having a heart attack, you should call for an ambulance without delay.